But the person has suffered COVID. It was traumatic for them, and they're scared that they're going to be reinfected, and their health is not robust enough to handle the reinfection. So their thinking is not really pathological. It's actually normal and common sense. So it's really difficult to kind of tease out what is pathological, what do we need to work on versus what is you keeping yourself safe and making smart decisions about your health.
Welcome to The Long Haulers, the official podcast of the post-COVID support community, where members connect with experts and other long haulers to learn how to heal from the effects of post-COVID. Here's your host, Munish Joshi.
Hi, and welcome to the Long Hauler podcast. We're here with Amanda Riley, registered psychotherapist, who's operating out of Niagara Falls, Ontario, and has been in business for 17 years as a psychotherapist. And if I was to say a few words about her, she is down to earth, genuine, authentic, and skilled, and a very passionate therapist in the area of anxiety, depression, and stress. And why is she so passionate? Because she herself is battling long COVID and is here today to share not just her experiences there, but also her expertise around therapies to help people who are dealing with stress, anxiety, and just life in general when living with post-COVID. Welcome, Amanda. And do you prefer Amanda, or should we call you Mrs. Riley? I don't know. What's the best way?
Amanda is perfect.
Okay. Perfect, Amanda. Amanda, you do have post-COVID, but out of curiosity, tell us a bit about yourself first, and then how long have you had post-COVID as well?
In December of 2020, I caught one of the original variants of COVID, and this was pre-vaccines, pre-everything, so no resources, and I was quite sick. I was horizontal for about 3 months, and it's actually my 2-year anniversary this month. Wow. Coming up on that. So, for the last 2 years, I've been living with chronic fatigue, POTS, conditions related to my heart rate, migraines, brain fog. The list kind of goes on and on. I'm a member of the Long COVID Canada group, as well as the Long COVID Media Ambassadors. So if someone from the media has a question or wants to speak to somebody about any aspect of Long COVID, they can contact us and we'll be available to make sure that they're getting the accurate information.
Interesting. And if I can ask you some questions just about your case in particular, because it's common for some people, they'll get COVID, but they won't get all their symptoms in one hodgepodge on day one. Did your symptoms progressively reveal themselves? I'm not sure of the right wording to use there. Or was it something where you just had this and now it's more inflamed, or it's just more of the same thing?
Yeah, I would say the acute symptoms resolved after about 3 months.
And what are the acute symptoms you had that resolved?
Extremely high fever, horrible body aches. I was so weak I couldn't sit up straight. I'd have to be constantly lying down. The headaches were the most intense headache you've ever had in your life. This was not a regular cold or flu. You felt like you were dying, and some days I thought I'd be okay with that because I just felt so bad and so sickly that Advil, Tylenol, all the usual go-to medications didn't seem to help this. So it was more like you have to go through it.
And I'm just curious, the go-to medicines didn't help, but what was the first thing that actually gave you some relief, if I may ask? Sleeping
lots, many hours. That's probably the time when I felt the best was when I was sleeping. Yeah, I lost 30 pounds because I had no appetite to eat. Thankfully, I didn't lose my sense of smell or taste, but I did completely lose my appetite, and my brain was not telling me to eat or drink. It just wasn't working properly, and it wasn't prompting me with those cues. So yeah, I lost 30 pounds. It was scary.
Do you mind telling us a bit about your emotional journey from where you were then to where you are now? Because that would be very interesting. Again, the feelings that people typically associate with this or will experience at some point is the stress, the anxiety, the frustration, and a variety of other things, and maybe even happiness, depending on where they are and how they get. But if you wouldn't mind sharing that, that'd be very helpful.
Yeah, absolutely. I think in the beginning, it was fear, fear of the unknown, this novel virus. What is it? What can I expect? I don't know. At day 14, my partner got better, like right on schedule, how people are supposed to, and I didn't. So I had questions about that, of course. Why did he recover? Why am I not recovered? So I think the fear and anxiety. I also took an ambulance on December 23rd, my very first ambulance ride ever, to the hospital because there was some breathing issues.
Oh, wow.
And normally that would have been a very anxiety-provoking situation for me, but I think because I was just so sick, I was so out of it. I didn't know what was going on. And so that was my first experience riding in an ambulance. But so fear, and then I think it goes to sort of a depressed place. Because it was new, people wouldn't come around. People, even after I was no longer considered infectious, people, even my family, wouldn't come near me because people were worried. So I think some low mood and depression set in. It's a particularly isolating syndrome.
Okay.
And because it's not well understood, there wasn't a lot of social support for me.
That was a time of a lot of fear too with COVID, right? That was a time in the pandemic where there was a lot of fear. So that makes a lot of sense. I think that you had that isolation and your family wasn't around. Yeah.
Yes. And even when I went to the hospital, it was kind of like right away, get you in for an x-ray. You don't have pneumonia. Okay, get out of here. Like, we don't want you here. You're COVID positive. Get out. So yeah, it was, nobody wanted to chance it.
Yeah.
I don't blame them.
Yeah.
And then I think it sort of morphed into this frustration now with all of these physical symptoms, cognitive symptoms, emotional symptoms. And of course, when we have a medical investigation or test, we want to get normal results. But for us, for long COVID patients, it's extremely frustrating when your lab results come back normal because we know what we're feeling. We know we're in pain. We know what our symptoms are. But unfortunately, a lot of the standard testing would not pick up on some of the things that we would be looking at, like microclotting or things of that nature.
Tell me a bit about the most common issues that you encounter amongst your patients who suffer from COVID-19.
Yeah, so people come see me for anxiety, depression, general stress, trauma. I do see a multitude of concerns in my practice, but I will say over the past 2 years, There has been an increase in health anxiety, health related phobias, loneliness, depression related to the pandemic. The pandemic has really changed people. There's a lot of people struggling right now. We've also seen an increase in overdose deaths and suicides, unfortunately. People don't really know how to cope in these unprecedented times. There's no rule book or manual on how to survive an eighth wave of COVID, or now this triple demic with COVID and RSV and influenza. Even me as a therapist, they didn't train us on here's how you deal with a pandemic. So what I do see and continue to see specifically with long COVID patients is there's a lot of anger and frustration and confusion in dealing with some of the medical community's narrative that it's this perplexing syndrome with no cure. So it often is minimized or dismissed, and it's a frustrating blind spot for physicians that can lead to medical gaslighting or even feelings of being bullied. So it's a journey of not only dealing with our health issues, but also figuring out the limitations of our bodies, trying to find treatments, trying to find answers, and, a general sense of hopelessness.
If you're feeling scared, frightened, and anxious, if you kind of get to that continuum there, what's the things that one can do to kind of help manage that in the near term before they go and see a psychotherapist? Is there anything you could do yourself to kind of say, let's regulate this, get this under control? Because one thing leads to another and just gets worse and worse.
Mm-hmm. The fastest and easiest and cheapest way to regulate yourself is deep breathing. That will slow down the nervous system and calm panic. I also like to use ice and placing it here on the chest to ice the vagus nerve, and that will also calm down people's anxiety if they are feeling panicked.
Just out of curiosity, where is the vagus nerve exactly? Like, is it just, if I was to put my finger there on the...
So I would put the ice in the middle of the breastbone here, but the vagus nerve actually goes throughout the body. Okay. Right, Ash? Is that right?
It does. It does. Yeah, it does. And I even...
She's the nurse, so...
Yeah. So I actually stimulate my vagus nerve or activate my vagus nerve through my massaging my abdomen. So I find the ice sometimes works for me, but if you kind of go down and then slightly to the left and then breathe in and then out and then kind of massage, and you feel that nerve or kind of feel that muscle release there a little bit. And then if you yawn, excuse me, then you know that you've gotten it.
That's good signs.
Also, humming or gargling, singing. Yeah.
Mm-hmm. Because it runs down
all the way
through. Yeah. It's really interesting. Yeah. This whole vagus nerve and vagal nerve theory, I find quite interesting. Yeah. But there's different ways to stimulate it. So if you sing or hum, those are whatever is accessible, feels accessible for different people. Some people like to sing and hum, some don't. Ice works for some. The belly massage works for me. Different things for different people.
Very interesting. Is that why with a baby, if you rub their belly sometimes, they just get more and more relaxed?
It might be, yeah. And it might help with gastric motility and maybe moving some of that gas around too. I think babies tend to get a bit of cramping. But yeah, that is probably it. You probably are stimulating their vagus nerve, which gets that rest and digest mode on, helps them relax, feel safe. Yeah, that would make sense.
This is very fascinating because it's not one solution here, but different things to try, which I kind of like because, everyone's a bit different. And if the cold works for you, great. But if the massage works better, then do the massage. And if the massage gets a little too hard or too time consuming, then go back to the ice. At least you have some options, which I think is very neat. So that's
Yeah, there's a lot of different options. And then more in terms of therapy, we have much more options and coping skills available.
So if somebody comes to you and they've got severe anxiety because of their post-COVID condition or long COVID, what are some of the things that you might do with them to help them find some solace and improvement?
So this is really challenging because the person is not wrong. So typically when you're dealing with anxiety, it's an irrational fear. But the person has suffered COVID. It was traumatic for them, and they're scared that they're going to be reinfected, and their health is not robust enough to handle the reinfection. So their thinking is not really pathological. It's actually normal and common sense. So it's really difficult to kind of tease out what is pathological, what do we need to work on versus what is you keeping yourself safe and making smart decisions about your health. Definitely, people are becoming more agoraphobic, not wanting to leave the house, things like that. So we would definitely try to do some exposure therapy, having them do little bits, and exposure therapy is always planned and very gradual, very small steps. So yeah, I think that's probably the main thing.
What would you say, Amanda, for people who are feeling like they're starting to become agoraphobic, they're starting to become a bit nervous about leaving the home? Some things that I mention are, well, why don't you could, if you have access to a car and either somebody to drive you, or if you have the capacity to drive yourself, that seems like a safe activity where you can go out into the world and you're protected. Especially as you mentioned, we're kind of in a triple respiratory virus situation right now with RSV, COVID, and the flu. What would you say for people who feel like they're heading in that direction, but what are some maybe preventative strategies or ways to kind of step back and prevent themselves from getting worse and being, finding that balance between protecting themselves and, not confining themselves to their homes?
I think when you start asking yourself that question, it's time to call a therapist and get some professional help involved and get some intervention. The earlier, the better, because when you become full on agoraphobic, it's a lot more difficult to treat versus if you're veering that way and we can steer you off of that path, then of course it's a lot less painful. So yeah, I would say if you're asking yourself the question, I'm not really socializing. I haven't seen people in a month. I haven't left my house. I haven't been outside in a week. If you're starting to question yourself, I think that's time for a professional intervention. Talk to a therapist, and they can help you with setting up strategies so that it doesn't become a more severe case of agoraphobia.
Like most things, early intervention is the most helpful.
And for people that don't know, agoraphobia is a fear of leaving one's home.
Tell you the truth, I looked it up while you were talking there because I was sitting there going, I've heard the term, but I want to be more precise on the definition, and and situational as well. So you're afraid of a certain situation that comes up, and I thought it was interesting because 500,000 Canadians are diagnosed every year with that, and us being 1/10 the size of the U.S., it's 10 times that in the U.S. So it's not uncommon, and these are new diagnoses, so it's fairly common, which I think is interesting. And just out of curiosity, is that something that you see appearing at a certain age, or is it something that's more situational, meaning that, if I got COVID, is this more pronounced with COVID? Or if COVID didn't exist, you'd see this amongst athletes or some other type of subset of the population?
I'm seeing this more situational,
Mm-hmm.
not necessarily exclusive to long COVID patients, but people who have been working from home through the pandemic. And
Interesting.
then all of a sudden their boss says, come back to the office. And a wave of anxiety comes over them, and like, I can't do this. I forget how to have small talk. I haven't been around people in 2 years. I don't know what I'm supposed to say. And people just being really comfortable in their own homes and being used to that. And I think when employers started to say, all right, it's time to get back into the office, there was a lot of pushback from people because, and I think because of that, the agoraphobia, people being anxious to return to the work environment, and even people that never had anxiety before or never had history of anxiety,
Mm-hmm.
it it has brought it out. The pandemic has brought it out in some cases.
Other than therapies, are there medications or any medicinal options for people, or even are there foods that you can take? And I'm a big food guy, to be quite honest with you. I always think that when you have a hot, flavorful soup, it just relaxes you, and especially something from a different part of the world, it's transformative. You think about that place, and it does some positive things for you. But are there any other techniques?
Mhm. Yeah, so in terms of food and medicine, there's no specific medication
Mm-hmm.
for long COVID, but there's medications to manage symptoms. So, for example, for me, I have a problem with my heart rate
Mm-hmm.
from the COVID infection. My heart rate is extremely high. So, I take a heart medication to try to keep it low. In terms of food, water is very important. It's very important for us to stay hydrated, about 3 liters a day.
Wow.
And salt intake has become very important for our population. So electrolytes with no sugar. Sugar is bad for us,
Mm-hmm.
for people with long COVID. So you want a sugar-free electrolyte drink to help replenish some of those vitamins and minerals that we've lost. That can be helpful. Depending on the symptoms, if they're dealing with dizziness or fainting or heart issues, things like compression stockings can be really helpful. Also, there's certain pillows or wedges where that kind of elevate your head a little bit when you're sleeping.
Mm-hmm.
Yeah.
Some people find that helpful
Yeah,
as
a
well.
lot of this is like that POTS or that POTS dysautonomia. A lot of these symptoms, like I find, and actually, it was just recently published, I think this week or last, that POTS is the number one condition that's diagnosed as a result of long COVID. So let me see if my brain fog will let me remember positional orthostatic tachycardia syndrome. So essentially, it's a
Yes.
nervous system disorder, but it's connected to the heart. And so, whenever somebody changes positions or gets a tiny bit of excited, rather than the heart doing a little bit of a higher heart rate to kind of compensate for that excitement, it goes off the charts. And as you said, Amanda, can go quite high, and there can be problems with blood pressure going really low, which causes again all of these symptoms that causes more heart rate issues. So yeah, doing things like that are I think can be very helpful for people with long COVID who do have POTS.
And
That's great.
for those who don't know, dysautonomia is just a term to mean that your nervous system isn't working properly. It's dysregulated. And another issue that we have difficulties with is temperature control. So I think that it's probably a circulation issue, but I'm either freezing cold or I am hot. So a fan and an ice pack are my best friends. And depending on the situation, I'll use either one that needs to be needed, or a cooling towel can be really nice, especially in the summer months. You have to be careful about being in the heat.
Yes. Yeah. And I think some of it too, or one of the theories also, it can be a circulation thing, especially with microclots, as you had mentioned before, and not getting enough blood flow. And there can be some inflammation in the brain, that the hypothalamus, which is responsible for temperature regulation. And yeah, that can be, I find I'm the same way in the summer. I cannot tolerate the heat, but then now in the winter, I'm having a hard time tolerating the cold, which is I don't know where that perfect location where I should live in between the warm and the cool, but I haven't found it yet.
So I got a cooling blanket. So on one side it's cooling. So I put the cooling side on in the summer, and then in the winter the other side is warming. So
that's pretty neat.
I just flip it whichever way I need it, and it seems to work well. I've been able to sleep, so that's been good for temperature control.
Yeah, that's great.
This is always fascinating to me, and there's a part of me that's biting my tongue, because my wife must have had this for a long time, because there's no happy median in my house for what the right temperature is. But I find that they're always freezing and I'm always boiling hot. I told Ashes before, my hands get extremely hot, my feet get extremely hot, but the rest of them stays normal. So it's very localized, and I don't know why, but interesting.
Interesting.
Just going back to some
our bodies are amazing.
Yeah, just going back to some of the well, actually, let's tie this into this here. If you have anxiety, the physical manifestations here can lead to the racing heart. It can change your temperature, I guess, if you get nervous and you're just kind of tensing up. But if you're depressed, and we haven't really talked much about depression, how does that manifest into some sort of physical stuff? Or just talk a bit about depression, if you will.
Mm-hmm. So, as I mentioned earlier, it's a very isolating illness. So, with depression, you'll see either sleeping more or sleeping less, a change in appetite, whether it be increased cravings or decreased appetite, weight changes, either gaining or losing, persistent low mood, and some people even have some dark thoughts or suicidal thoughts that come up for them. And I think this is where you need to find a community. You need to find a community of people that are going through what you're going through, and people that understand. Not a support group to commiserate with. That's not helpful. That's not what we need. We need to be around other people who understand what we're going through. And I think a helpful support group empowers its members to take good care of their health and provide good, quality, reliable information. So in the groups that I'm in, you can't just post an opinion. If you're going to say something about COVID or long COVID, you have to post the evidence-based research article with it. So it's not just a free-for-all of people sharing misinformation.
I was going to ask, is venting good? And if so, is there a good way to do it in a safe place to do it? Because I don't disagree with you. Online isn't a place to dump thoughts and opinions and pieces on that. But which aren't evidence-based, but is venting a healthy thing to do? Because I find sometimes with not just you don't have to have code for this, but when you just let it out, it just feels a lot better.
It depends on the person. For some people, that's what they need and that's what they want. It's in the same with psychotherapy. Some people don't want strategies or coping skills. They just want to ventilate. They want someone to listen to them. They want to talk and they need to get it out, and they feel so much better afterwards. So I think it varies on the person. But while I'm not against venting, I do think we should be cautious about how much time we're spending venting. I would, if it ends up where you're venting and kind of complaining all day long, that just puts you in a negative mind state. So
Yes.
I feel like, maybe saying you're going to vent to your partner or to your family or to your friends for 20 minutes, but then you're going to move on and talk about something else. Because, it's helpful to get things off our chest, but we don't want to stay in that negative space all the time.
Yeah. And you touched on it earlier too. When you join a community, it's not about a community of commiserating, because then you're just living in that negativity. It's about getting together, having a constructive dialogue, I guess, and saying, here's how I feel, here's what I've tried, and this is what's working, and this is how it could work for you. I think that's an important part of everything. Is there some things that a community is not necessarily helpful for?
Not necessarily helpful
Yeah.
for?
Like if I have PTSD, or if I have a fear of groups, would this be counterproductive for me?
Yes. So a person that has a fear of groups or social anxiety would most likely not benefit
Mm-hmm.
from a group format. Someone that is dealing with trauma
Mm-hmm.
may have difficulty with a group format because we don't know what's going to come up on the feed.
Mm-hmm.
We can't predict or give a trigger warning before
I see.
so-and-so starts scrolling through. So I would be cautious about that.
Mm-hmm.
And, I would say visit these groups, see what people are saying, see what people are talking about. If there's helpful information, and a little bit of venting is okay, but we want to try to help each other and be productive, because the situation that we're in is negative enough. The health issues, the comorbidities, everything that's come along with this COVID-19 infection, it sucks. That's my clinical term.
It does. It does. And I think calling it out for what it is helpful, and not pretending that it's fine and, pretending that everything's okay. I think there's space to hold that, this really sucks dealing with this and trying to navigate this right now where there's not enough research and not enough knowledge about it. And there can be some positive ways to cope with it. There can be, relationships that you build as a result of it, and find space for maybe both parts. Yeah. And finding that balance can be hard.
This is really interesting, but I actually found a group of other psychotherapists from around the world that deal with chronic illness. And so we were meeting for a while to kind of talk about that. What's your experience like working as a psychotherapist with a chronic illness? And a few of the people also had POTS or conditions related to long COVID. So that was really helpful for me to connect with other people and know that they're still working as well, and to get their strategies and how they're dealing with things.
If you're afraid of a community, and I was thinking about this sort of thing here, if going into a social setting doesn't mean you jump in and you participate in a big conversation, imagine that big party at somebody's house. You're not jumping in there, but there's a way to enter a conversation. You come in and you observe. So just like you said, you go into a group, you kind of see what's out there. You don't know what your triggers are, and we don't know what your triggers are. But if you know where they are and where they are not, you know the safe space to enter from. So I think for people looking for help, I think it's important to say that, if I feel anxious looking at all this stuff about diet because I hate cooking, don't go looking at the diet stuff. Go look at other things. So I think there's a safe way to enter a conversation. And then you also have to get comfortable with the people, know who to approach, who not to approach, how to approach them. And it's just about you just acknowledging the fact that you need some help. You see these people are getting some benefits out of this. They're all talking about something you understand. They must know something there. So I think there's some really creative ways to go about finding some help. The great thing about being online too is you're not physically there. And there's also that sort of benefit that comes to you. And if you don't like something, you don't have to go back to it. You don't have to click the same link again. So I just wanted to...
Absolutely. And people can join these groups and they can just sit back and observe. There's nothing saying that they have to post or that they have to make any contribution. They can just observe and read if they want to.
So you can add to the thing, you might become a voyeur as well because of post-COVID. So post-COVID voyeur. Sorry, Ash.
Amanda, no, that's okay. I was going to ask if you're comfortable speaking to it. I know you had said that this is your 2-year anniversary coming up. I'm coming up to an anniversary as well with my post-COVID. How does that make you feel? If you're comfortable with sharing, if you're not comfortable, that's okay. We'll just cut this part out.
Yeah. No, I just had the anniversary on December 16th, was 2 years. It makes me sad that I'm still in this place. I actually didn't even start getting help and referrals and specialists and people taking me seriously until a year in.
Wow.
So it took a year in to finally start getting doctors to look at me and ordering tests and ordering exams. So I think of all of that lost and wasted time where I didn't get help. I feel sad and I feel frustrated with the lack of attention and funding and research on this topic. We are far behind with our research in terms of long COVID and its effects. It is a level 3 biohazard and it attacks our brain and our organs. Why are we not putting money into that? That's important. And I just think that another part of my frustration is being dismissed, or when you have a toothache or something, and then when you go to the dentist, the tooth doesn't hurt anymore. I feel like that happened to me because I had a heart rate of 178, and when I went to the cardiologist's office, he was telling me it was only 52. So I was like, what's going on here? That is, so just that kind of frustration. I feel sad and discouraged, I guess, because I feel that, there's no excuse for us not to receive some form of care. And I feel that if, even if your care team, your doctor, your nurse practitioner, whoever you're working with, even if they don't know what to do, acknowledge your symptoms and refer them to someone who may be able to do something for them.
Exactly.
Don't just give up on
So
people.
who in your medical journey gave you the most benefit in support and helping you get better then? If it's not the GP and it's a specialist or some, for you specifically, and everyone's case is a bit different. Like if you've got dizziness as major impacting problem for yourself, or insomnia, then clearly a different path for you. But what was yours?
100%. I've seen many people, and 100% the person that has been the most helpful has been the internal medicine specialist. And I asked for this referral when my GP said, there's no cure for COVID. There's no medication that I can prescribe for you. So I asked for a referral to an internal medicine specialist. And he is brilliant, and he has ordered all of the tests that are necessary. He's offered to repeat tests if things don't seem right or accurate, or that they weren't done in a way that he wanted. And he's provided other referrals as well. So I would say the internal medicine specialist has been the best. And I guess he sort of covers everything. So, but he's a great doctor.
On the flip side, then, what type of pathway would you avoid? Like, what I'm really trying to get at, if you can go back in time and give yourself advice on what you could have done differently to get you to a path of healing faster, what would that be? Don't do this, do more of what? And that seems to be go internal medicine, but what's the other side of it?
Mm-hmm. And I don't know that that's the right answer for everybody. Some people's GPs are very involved. Some people's cardiologists are their go-to person. I don't know if it's going to be the same for everyone. One thing I may have done differently is gone out of the country to look for support. The UK is doing phenomenal things with their research, and specifically Scotland, they are way ahead of the game, and they have doctors and specialists there that this is all they're studying, this is all they're focusing on. So I feel like I would maybe branch out a little bit and explore more of my options and not just feel confined to this space.
Curious, with research, it's not just gathering the data, but they must be trying some new therapies. Are you seeing any type of therapies and that are showing some sort of promise here? And just for people who are watching and listening to this here, don't go running out there and getting
Yes.
this, because as you can see from this, it's hyper focused and everybody's very unique and you have your own stuff. So even though you hear something promising, you got to work with the person who knows you and your medical history the best before you go trying something, because it may be more harmful than good.
Right. So disclaimer, I'm not a medical doctor. This is not medical advice. One thing that they're doing in the UK is they are doing saline infusions or lactated ringer infusions. And they are doing 2-liter infusions. And it is really helping people. And it is so simple and so cheap. Such a cheap and easy solution to try. And even if it didn't work, it's not hurting you to have the saline.
Just
So
for the average everyday person, what is that exactly, if you wouldn't mind just explaining? Because, well, I've got images in my head.
I can explain
Please.
that. Yeah. So essentially, what the medical community is doing is taking fluid that is specialized and sterile, putting it in through the IV. No special medication. It's just balanced, so that it's in balance with your body. So essentially, what happens is that volume stays in the blood system and kind of creates that expansion in in the body, in the blood system, in the blood vessels, which then creates a more stable blood pressure, a more stable heart rate. The organs, what we call end organs, so your brain, your kidneys, your liver, all are getting this proper blood flow in a way that it typically doesn't with long COVID, or with POTS rather, or dysautonomia. And so what happens, so with that high heart rate and the low blood pressure with dysautonomia, it can cause all these symptoms from a lack of proper blood flow to the organ. So a lot of people get nausea and loss of appetite because the GI system is not getting what we call perfusion or good enough blood flow and blood circulation. Get a lot of brain fog because the brain is not getting that proper circulation and that proper blood flow and nutrients and oxygen. And so by putting, 2 liters into a system, into that circulatory system, into the body,
Wow.
2 liters. Yeah. And so it is and it isn't. For us to give 2 liters in the medical community, you just throw it up there, and that's not that's not a big deal. It's like drinking 2 liters of water,
Fair enough.
or salt water, like a lot of us do in the POTS community. And it's a lot more palatable because drinking salt water can be very challenging, and it's not what our body is naturally used to, so it doesn't feel normal. But that's what happens. It creates that blood flow. And then essentially the theory behind it is that then with that great blood flow, people can get up, they can move around, they can recondition themselves to do more tasks, recondition their body. And then eventually over time, ideally, they won't need the IV infusions anymore. And like Amanda said, it is low risk, and possibly pretty high reward.
Just out of curiosity, is this liquid salinated in any way? Has it got sodium in there, or is it just sterile?
It does. It has sodium. Yeah, it's sterile. So to be in balance with your body, it's an isotonic solution, it's called. So it has a balance of water and other molecules. Without getting too complicated about it. But there is like salt. It's salt water balance.
Why do you think they're not doing that here in Canada? I know Canada is notorious for let's wait and see, or our water has too much maple syrup in it. I'm not sure what the reason is, but why?
It might be the maple syrup. I don't know. It's delicious though. So I would hate to think that that's
what I'm thinking.
the problem.
Maybe it'll work better here.
I know. Yeah. So I've actually tried this one time. I guess in other countries, they have mobile nurses and medical services, people that will come to your house and you pay for this service. We don't really have that here. I tried to find somebody. I found a nurse that would do it, but I couldn't get a hold of the equipment. So I think RT Medical is going to help me figure that piece of it out. But I did find a naturopathic doctor who did one of the infusions for me. We just did 1 liter to try it. The issue was, and he was so kind to let me test out this protocol, it took 4 hours for the drip. So I had to sit there at the naturopath's office for 4 hours. I was sleeping. I had a recliner, lazy boy. I had the eye mask. I knew I was going to be there for a long time. So I went to sleep. So then I thought, if we do the 2 liter, that's going to be double the time. So I'm going to be here for 8 hours. And that's not realistic. I can't be here for 8 hours. I need someone to come to my home and do it. So, I'm trying to figure that out.
How long does that last for? Like if you'd only do this, once a week, once a month? Like what is the research out of the UK producing? What are they doing?
Ideally, once to twice a week.
Wow.
Yeah. So the saline really will only stay there. Yeah, the saline will really only stay there for a couple hours, and depending on your body composition and what fluids you receive, and a lot of other factors, how long you'll hold on to that fluid for. But typically, twice a week would be kind of considered ideal, I think, for most.
So let me just tie this back to Amanda's specialty here. So if you've got anxiety, you've got racing heart. You've got something that's starting to affect your system, dysautonomia and POTS. If those things are coming on because of these. I don't want to call them mental health issues, but because of these effects in the body from post-COVID, then this is an interesting path of exploration for sure, and the research is going to reveal how effective it is. We don't have access to that here. I know that today's select people in the community do, but in lieu of that, what happens if you don't have dysautonomia? What would this do for you? Does the research tell us about that? Because not everyone does, right? Or POTS.
The IV fluid?
Yeah.
Yeah. If you don't have it, I mean, it depends, right? So you'd have to be careful, which I think is where the medical community's hesitation is. I'm not going to go right too deep into that because I've conflicting views about that. I think it's, a low yield test that's probably worth doing, personally from a professional perspective. But aside from that,
if somebody came to you and said, "I'm suffering from fatigue and insomnia," and you said, "Well, let's try this." Would they be a candidate for this? No. Okay. So who?
They wouldn't. No. It would have to be somebody who we know who has POTS, who we know doesn't have heart failure, who we know doesn't have some other, you'd have to rule out some other comorbidities. We'd have to rule in this POTS dysautonomia. It would have to be a very specific situation, because you do have to be careful, overhydrating some people. But, for most people who do have POTS, I think it'd be a fairly safe. Yeah.
I gotta say, you said some key things there, Ash. Number one, you have to make sure you're a candidate. It's not that you read this stuff on the internet and it sounds great. Even if you hear it here, you have to be the right candidate and some people don't know that they have underlying issues and they need to be thoroughly checked out before they become a candidate. So it's great that you say that.
Challenging thing about long COVID is that it's so individualized and it's so complex. So making sure that the treatment options or the treatment pathway that you're choosing is appropriate to you, is safe, and is not going to do more harm than good.
I appreciate that because it's incredibly helpful, because what you're really describing is when you suffer so greatly and for so long, you're willing to try all sorts of things, but it has to be done properly and it has to be on the right thing, and you have to be the right person for it. And I know if people tell us, "I'll be your guinea pig for this," will you? If I told you that it's going to cause you to lose all your hair, you might reconsider it. And these are things that may be real byproducts that could be of risk to you. So you need to go to a better professional. But I do want to go back to some of the basics here. Frustration, anger, depression, these are the kinds of anxieties that people deal with. How do you help somebody who's feeling frustrated? What are the treatment plans that you offer to people who are feeling stressed? Because you did also bring up the fact that people are being asked or being pressured to return to work. So how do we deal with stress on a day-to-day basis?
Yeah, I think first validating their feelings, and working with them on what's your main priority right now. Is it return to work? Is it, medical advocacy? Like what do you need from me? How can I help you? Like, you tell me what you need and I will create an individualized treatment plan specifically for you. Some people need coaching around how to go to a doctor's appointment, how to ask questions, things like bringing a notebook with them, writing notes, taking things down, dates of tests, creating your own medical record. I think I want to empower people to become the expert of themselves so that when they go to any healthcare provider, they can confidently speak about what they've done, what's worked, what hasn't worked, what tests they've had, what they haven't had. Because I think that's where a lot of the frustration comes from is when you're trying to get treatment medically. So, and then in terms of the depression, the anxiety, I don't paint every person with the same brush. Everyone gets their own individualized, customized treatment plan. But, in general, I guess I could say, I would use more of a CBT or cognitive behavioral therapy protocol to try to change some of those problematic thinking styles into new, healthier, more balanced ways of thinking.
Thank you. I'm just making notes of this because I always like to think of those plans that one would have to healing. And you basically said it here is you want to validate your feelings. You got to decide what your priorities are. And then you have to design a plan around those priorities and the things that are most important to you. And then a lot of times people need coaching and guidance and how to execute that plan in your day-to-day life. Would that be accurate to say that's what kind of the treatment plan would look like if you're dealing with stress and possibly anxiety as well, depression?
Yeah, yes, if that's what the client needs and wants, then that's what we'll work on. And also, techniques for anxiety reduction, stress reduction. We would want to also incorporate some coping techniques for that as well. But I think when you're dealing with someone with a chronic illness, there's so much stigma around that. The first thing I want to do is validate that person and say, I believe you and I'm here to help you and we're going to figure this out.
And that's powerful. Hearing that is powerful, especially with invisible diseases and chronic diseases, right? Because a lot of people are, and I think a lot of family members don't mean to gaslight and dismiss people's symptoms, but they sometimes can take some time to, wrap their heads around it, or that might be their coping mechanism is denial. So I think validating people's experiences is very powerful.
That's another piece is the family education. And so it's not just for long COVID patients, but for any mental health patients, including long COVID patients. So if they're having difficulties, my family doesn't understand my anxiety. My family doesn't understand my bipolar disorder. Do you mind if I send, would it be helpful if I sent some resources to you and maybe you could share them with your family and help them to understand better? I have all kinds of resources at my fingertips, and the family support is such a huge thing. My family did not understand the POTS situation, so the orthostatic hypotension. And I felt bad about that they weren't really, I didn't feel that they were really getting me, or when I said I was tired or I couldn't attend certain things because of my long COVID and POTS, I felt like they didn't fully understand. So someone in the group suggested, why don't you send them the POTS video on the front page of the Dysautonomia International website? And I did. I sent it to my mom and my father and my brother. And the next day I got a message from my parents saying, we're just sitting here having coffee and breakfast this morning, and we just watched this video. We can't believe this is what you're dealing with. We're so sorry. Like, how do you feel today? How's your heart rate today? Is it high? Is it low? So now they're really trying because I think they just understand more.
Mm-hmm, mm-hmm. And I think you got to the core of it. It's helping other people understand. And sometimes that can be challenging, for a condition that is not well understood by a lot of the medical community who are supposed to be the experts. So tips like that, I think, can make a big difference in people's lives and their relationships with their family.
And so I can provide those resources for clients to share with their family, like easy, 101 explanations to describe and explain what they're going through, so that hopefully the goal is for them to receive more support and understanding from their support network and their families.
It's very interesting. And you did say as well, when you have something that's chronic, you need, and when you feel anxious, especially, you need coping strategies. But in this case here, you also need communication strategies, because how do you talk to a child about what's going on with the parent, especially if you have young children? My wife has a brain injury, and the children were very young, and she couldn't go to their birthday parties for many, many years. And as they got older and could understand what was going on in her mind, then they could understand why she wasn't present in certain situations. So I think it's important that people seek your support, or that of any psychotherapist, to talk about their issues, talk about what's going on, and to really discuss and describe their challenges, because it might be closer to home than you think. I've from our support circles too, there's people who tell us that their spouse just doesn't believe them. Their doctor just won't believe them. So how do you live with someone who's not willing to be a willing partner in your healing? And you need them to be. So I think you provide a valuable service. And just to be clear, you do provide that service to help people understand how to talk to their family members and get the help.
100%. And sometimes it's a family session. Sometimes it's like, you know what, let's bring your family in or your spouse, and I'm going to help you explain this to them. I'm going to facilitate the conversation. I'm going to be the mediator. I'm going to make sure that your voice gets heard and that everyone has a fair opportunity to speak. So that's always another option that I offer.
That's great. That's an amazing service. Yeah. Amanda, just switching gears here a little bit. I'm interested in your thoughts about, if you could speak with the health minister, what would you say from your, perspectives as a mental health provider, as a long COVID survivor, patient? What are your thoughts with that?
It's a deep question.
Leadership starts at the top. I think people's attitudes towards long COVID need to change. The dismissiveness cannot happen anymore. We need the funding. We need research on this topic because it's not going away. And each time you get infected with the COVID-19 virus, the damage to the organs and the heart is cumulative.
It is.
So it's not going anywhere and it's not getting any better. So it's time to get on board and we need to figure this out. From my understanding, obviously I'm not a medical doctor or a nurse practitioner, but a lot of the tests that are needed, the things that they're looking for won't be detected on a standard test.
Exactly.
And just with, again, going back to the UK, I'm obviously really impressed with what they're doing. Let's connect with them. Let's connect with their experts and see if there's things that we could be doing here. I think it's gone on long enough where we've talked about COVID as this mysterious, novel illness. That's not good enough anymore. That's not good enough. It's been 2 years or maybe more. We should know. We should have information. It's not acceptable anymore to say that. In the beginning, when I first got COVID, of course, nobody knew. It was new. People were scared. There were no vaccines. I get it. But now, after all this time has passed, there is no real excuse for why we don't have treatments or therapies or funding or research in place to look at long COVID syndrome. And also, some
some
people are
powerful
not
words.
able to work. Some people need to take disability, and they're being given a hard time for that. Like, well, COVID-19, is it long hauler syndrome? Is it a disability? Is it not a disability? In the state, I mean, I believe that they have categorized it with an ICD code.
Yeah, I believe they have too. Yeah, meaning that it is recognized nationwide as a disability, which is a very appropriate, right? Yeah. Yeah, those are some powerful words. Thanks, Amanda.
Yeah, I find
Welcome.
this also fascinating. We can go on and on with this thing here, and I think it'd be really interesting one day to do the same conversation, but bring in some people who are patients or people who are living it. I know you both have long COVID and are living with it, but there's people at different stages of the journey. I think they just need to hear a bit more up close. And they might have different perspectives, because one of the things I didn't talk about here is the role of technology in helping you with your healing. So, if you're feeling frustrated, you mentioned it, or I've heard it before, apps. There's some apps that help you calm. Actually, there's another doctor that mentioned this. They just said use an app, and these apps help you meditate, teach you some things. There may be an app out there with some information that can be of value as well. So there is a role in using this new technology, new
There's
platform.
there is a little piece of technology that I have. I'm not endorsing or promoting it. I don't know for sure if it works for me yet. I haven't used it enough, but it's an app with a little piece that you clip onto your ear, and it plugs into your phone, and it's to measure heart rate variability, and also train your heart rate variability. So I haven't used it enough to give a fair
Interesting.
review of it, but there are some things coming out. I know that there is another piece of equipment that you plug into your phone at the bottom, and you put your two fingers on top of this little gadget, and it does a blood pressure reading, and heart rate reading. So there are things out there, and there's another one I think that you put on your left side of your chest, and it actually sticks to you for a week or something, and it records and monitors everything. It's more sensitive than a Holter monitor, and it picks up on things, and at the end it will generate a report for your physician. So I wish that my doctors were telling me about this, and not me coming to them asking about, do you know about this? Can we try this? Can we get this?
Mm-hmm. Yeah.
But again, I'm invested in this. I'm passionate about it because it's happening to me. Whereas GPs, they need to know a lot about everything, not just one topic. So,
And they can typically go home at the end of the day and forget about it, right? Which is not a fault on them, but those of us who are living with this and can't escape it, it makes sense that we're a lot more invested. I think we could do a whole podcast on technology,
I think we should.
and wearable devices and whatever with long COVID. Yeah, yeah. And to mention too, our app, our community is an app that you can use on your phone. You can access the community through the app, through your phone, or on your laptop or computer desktop. But it is something that you can access. You can kind of have right there. So if you're feeling a little low and you want some to see what some others with long COVID, how they're feeling or how they bring themselves up, or looking for support, or to attend one of your group therapy sessions, Amanda. They're on Mondays. Remind me at noon?
12. Yes.
12. Yeah. Noon Eastern Standard Time. so they can join in and have their feelings validated, and all of the great things that you will help them with in the group therapy sessions. We also have some nutrition classes, some mindfulness sessions, some kind of stretching, kind of low-level physical activity sessions for those. Most of us in the long COVID community need, a very slow bridging up to physical activity. So that is one way that we are trying to help the long COVID community in a technological, advanced way, and trying to bring support to them, where they're at. So that's something for everyone to look out for.
And there's the resource library in there as well. There's sessions that we record and we can put in there.
Yes.
So it's not that you have to wait for the Mondays, but if you miss a Monday, and we've got the library of things there, or some of the other course material in that, at any time of day when you need it most, it's there. It's accessible. It just takes time. And if you're new to communities, don't know how to navigate technology in that, it's a very familiar format. It's very simple, very easy, icon driven. It's actually very inviting when you play with it on a mobile device, tablet, or laptop. So, Amanda, what's the best way for somebody to get a hold of you and your services that they want to reach out to you directly?
Yeah, so if someone wants to reach out to me directly, the best way is through my website, and it's www.amandarileypsychotherapy.ca. There is a contact form there. There's also ways to book a consultation there. I offer a complimentary 15-minute consultation with clients to determine good fit and our appropriateness for working with each other. And specifically my long COVID people, if you would like a therapist that is in the trenches with you and really gets it and understands, please, you're more than welcome to contact me.
Very good. Thank you, Amanda.
Thank you for having me.
We're happy to have you. It was a pleasure, Amanda. Yeah.
Thanks for joining us for this episode of The Long Haulers, the official podcast of the post-COVID support community. We hope you enjoyed this episode and that it'll help you take a step toward leading a healthier, happier, and more productive life. Take charge of your recovery at postcovidcommunity.com, where you can learn more about membership benefits and join our newsletter to get the latest information and tips from our network of specialized healthcare professionals. And don't forget to follow us on YouTube and your favorite social platforms at Long Hauler Life. Please share this episode with other long haulers in need of assistance. Take care.